My name is Ansu. I am the NCLEX Program Manager at Avant. So I am originally from India. As you might have already figured that out. Nobody can miss an Indian accent. I love teaching. Teaching is my passion. When I learn something new, I have to share it with 10 other people, and that's in my blood. I love this role because I have been an international nurse, right? I have been in their position where you wait to take the NCLEX exam, then you wait for the paperwork, and I have been there in their shoes, so I feel like I'm giving back to them through Avant, which is a beautiful company, have a beautiful mission statement, and do everything right for the international nurses. When I joined Avant, and they said, oh, they have driving lessons today. And I'm like, what do you mean they have driving lessons? Like, who's helping them? And the team at Avant said, no, we help them with that. We help them make sure they buy a car. I'm like, wait a minute, where were you when I had to start? I mean, the things that Avant does for their nurses, you won't realize it until you hear other story. So it was a struggle because we were all by ourselves, no family here, and my uncle and aunt are in Atlanta. They, come over and help me, but other than that, I had to figure out where's the DME office, how can I train for driving. We had to figure everything out on our own. And I did not even think the agency had a responsibility to check in with their nurses, make sure they are surviving, make sure they're getting an interview and a job. I love that we are doing that for our nurses, making sure that they are not just adapting to their clinical setting, which my hospital did a great work with the clinical transition, but also helping them adjust to United States, because we don't know things here. It's a lot different from where I come from. So it has been fascinating. And the funny thing is, during the time of orientation, I spoke more than the people who were giving orientation, because I'm like, what do you mean you're doing all this for the nurses? Like, it blew my mind. Being the NCLEX Program Manager, like I said, is a very fulfilling role because, again, I feel like I see myself in all of these testers, so I don't know how to express it, but it's beautiful. And I do get the opportunity to connect with a lot of testers one-on-one. And it's so amazing because some of the testers, I may be doing a coaching call to help them with safe and effective environment or to teach them calculations, right? So I may have arranged for a few sessions with them. By the second or the third sessions, they're like, can I bring my daughter over here? She wants to meet you. And it's so amazing that I get to meet their family, and they're excited to meet their mom's teacher. So, next time when you're on the call with me, bring your family, I wanna meet all of them. Avant offers a great NCLEX program, especially it's not easy to manage nurses from all over the globe, right? Because their learning needs are different, and the way they learn is different, their time zone is different, there are a lot of factors involved, but our instructors and our coordinators do a phenomenal job making sure that they are calling at the right time zone, addressing the individual needs of the nurses, and giving them different platforms. So they actually, although you don't see that part of it, they do a great job behind the scenes, right? They individually assess you. They look at your documents multiple times. Okay, how can I help this HCP so they can study well, prep well, and be successful in the exam? So they look at tons of resources. Like I said, you may not see that part, but they do their research to see, okay, this person is struggling with critical thinking. What are some of the resources I can provide to this nurse for them to be successful? So even though there are so many HCPs in our program, they all get that individual attention, which is phenomenal. They call them periodically to check in and make sure that, their individual needs are addressed. They also talk about what's going on around the country, what is going on around in their family. Are they sick? Is any of the family members sick? So we are not just looking you as a nurse who has to pass an exam, but they try to make a connection with that individual, which is really amazing because, when you look at the programs out there, I can tell you a lot of tutors that I have met, all we are worried about is your NCLEX pass, right? But Avant is different in the sense that we try to make that personal connection, and you are already a family here. So by the time you come over here, we already know everything about you. So that love, that concern, that compassion is there from the time you register for the program. The whole NCLEX program is divided into two phases, phase 1 and phase 2. Phase 2 is a little longer, where they start applying that critical thinking, and they do multiple body systems like respiratory, musculoskeletal, cardiac, neuro, and so on and so forth. And by the end of phase 2, if they need additional help, right? They may have to remediate some of the modules. They may have to do additional exams, just so that we know they are ready. While this learning is happening, we are also doing the paperwork behind the scenes. So we work very closely with the licensure and travel team. So they prepare their CGFNS documents, and they get a lot of guidelines, and that's something that I appreciate, because not everybody is fortunate to have all that assistance with the paperwork. So they do the CGFNS document, and then once they are ready to register, which means that we are submitting the application to the board, and then once NCLEX team feels like they are ready to schedule, they mark ready to schedule, then the travel and licensure team will schedule their exam date. So the scheduling of the exam date, the travel to the exam center, the accommodation, everything is paid by Avant, which is beautiful, because my dad paid for all that. I do have the experience in teaching in some of the colleges here in Central Florida, and the graduate nurses themselves, some of them have struggled with NCLEX, but most of them, during their curriculum itself, they are prepared to take this exam. So from the moment they hit nursing school, they know they have to pass NCLEX, and they do a lot of practice questions throughout the nursing program, which is similar to NCLEX, so they are well prepared to take the exam when they are out. Versus an international nurse, this is the first, one-of-a-kind exam that we're taking, because I can tell you in India, when I was doing nursing school, majority of our exams were essay type, that you write paragraphs after paragraphs after paragraphs, and as long as you have your points in there, you get good score and you pass. Even if we did have multiple choice questions, it would be 3 wrong answers and 1 right answer, so it's so easy to pick. Versus when it comes to NCLEX, it's pretty intense in the sense you have to know all these facts and then apply it to that critical care scenario and make the right choice. So it's pretty intense in that sense. Plus, you could have 4 right answers, and then you have to prioritize what's the best action or what's the first action. So you do need to have the foundational knowledge and apply it in that critical care scenario, which is very challenging. And that's the reason why a lot of international nurses struggle with NCLEX. However, like I said, Avant program actually gives them step-by-step guideline, building that foundational knowledge, and in phase 2, they start applying it. So the different platforms that we use here are meant for specific purpose. So the first platform that we use is to build that foundational knowledge. Second is to apply and have a comprehensive understanding of the test. So if you follow Avant guideline, I know it's pretty intense, a lot of homework, but at the same time, if you follow that pattern, you will be successful. Our success results for this month, and we are at a 94% pass rate, and knock on wood, I don't want to jinx it, but we are doing really well because we have some amazing nurses all over the country who are dedicating their time and ready to partner up with us. I mean, we can have a great program, but if our nurses are not following the guideline, it's never going to work, right? So I do appreciate all these nurses all around the globe. We are telling them, hey, do 3 platted exams in 1 week, and I know that they are working full time, so they are working 4 days, 5 days a week. They have a family to care for, but they still follow our guideline. That shows some commitment. So when I speak about success rate, I have to speak about the success rate of those nurses.